Decisions about whether healthcare is a right or a privilege. Decisions about where people live, work, and play. Decisions that affect structural racism, and decisions that affect the environment. Who better to weigh in on those decisions than nurses? Nurses have been engaged in this process for over a century, and it is these contributions that we celebrate during the year of the nurse and midwife, as well as, and I'll remind us, the 100th year anniversary of women's suffrage. But while many nurses have risen to the challenges required to improve the health of the public, some have participated knowingly and unwittingly in the barriers that often prohibited access to care to the most vulnerable populations and access to nursing education to men and women, some men and women. Nursing's history reflects this too, and nursing's efforts to progress. So we go to the next slide. To begin, I start with the modern nursing movement beginning in 1873 and highlight the relevance of advocacy in the history of nursing. Florence Nightingale, known to many as the founder of the modern nursing movement, set the stage in the mid-19th century for a new profession for women to emerge. Nightingale used her knowledge that she had gained during the Crimean War to establish the St. Thomas School of Nursing in London. The ideas she developed at the school, where women controlled the training of other women, created standards of practice and discipline, and it made her an international voice for education of nurses throughout the world. Next slide. In New York City, the famed Bellevue Hospital established one of the first Nightingale-influenced training schools in 1873. Now that year marked the beginning of a revolution whereby hospitals recognized the economic value of using students as staff. This apprenticeship model of education struggled with the notion of how much theory versus practice should be included in nursing training. And I dare say we still have that same issue today. Next slide, please. It took another 20 years for superintendents of the many schools that did open following 1873 to recognize that they needed to organize into professional bodies to gain control of both practice and nursing education. By 1893, thank you, next slide. By 1893, the world was changing and the women were gaining a voice in what was known as the women's movement. Begun in 1848 at the Seneca Falls Convention, women sought the suffrage as a way of gaining control over their personal lives. Nurses, mostly women, sought control over their professional lives by organizing professional associations. At the Chicago World's Fair held in 1893, 18 nursing superintendents in charge of the training schools in hospitals throughout the United States met and formed the Superintendent Society of the United States and of Canada. The main goal of this organization was to establish standards for schools of nursing, and that would assure the quality of the graduates and the care that they provided. By 1912, that organization renamed itself to the National League of Nursing Education. And then in 1952, when nursing was reorganizing, became known as what we call it today, the National League for Nursing. Next slide, please. The leaders of the earlier NLN, Linda Richards, Isabel Hampton Robb, Lavinia Dock, Adelaide Nutting, Sophia Palmer, just to name a few, contributed to the landscape of professional growth in the United States. These women recognized that the NLN represented the work of the superintendents, but not of the practicing nurse. So within 3 years, they established what became known as the American Nurses Association. Next slide, please. By fostering the growth of the alumni associations at the various training schools, nurses joined together and formed the ANA to address the issues of practice. The ethics, the standards, and the support for the working nurse were all part of this organization's goals. And these women, many of them, the same names as I mentioned before, sought to marshal their organizational voice, state by state, through the alumni associations, to lobby the state legislators to create registration laws. Next slide, please. These laws were to be established to support both the nurse's livelihood as well as to assure the public of who was calling themselves a nurse. Some of the earliest registration acts were passed in 1903 in North Carolina, New York, and New Jersey. Others were soon to follow, but it took almost first half of the 20th century for all states to have some legislative protection for the public and the professional. Next slide, please. In 1908, Black nurses joined together under the leadership of Martha Franklin and Ada Thomas, forming what was known as the National Association for Colored Graduate Nurses, the NACGN. Like the NLN and ANA, the NACGN was concerned for the education and practice of nurses. But in addition, they had to address the blatant racism they experienced every day in hospitals and in schools of nursing. Next slide, please. Whether restricted by law or by custom, the NACGN politically advocated for the rights of Black nurses and ultimately the health of the Black community. The work of the NACGN documents the many challenges that Black nurses faced in a variety of settings. Next slide, please. For example, one of those fronts was in the American Red Cross, and specifically I'm looking at the Town and Country, a rural public health nursing program that was started in 1912 and required a postgraduate education in rural public health. One of the only such programs to accept Black nurses was the one held that was given at Teachers College at Columbia University right here in New York City. Next slide, please. Frances Reed Davis in 1917 became known as one of the first Black nurses to enter the American Red Cross Town and Country, a privilege that was denied to Black nurses until then, and it was limited even after. Next slide, please. Ada Thomas, the president of the NACGN, along with the Circle of Negro Relief, which was an organization that grew out of the Circle of Negro War Relief that had begun in 1917 during World War I, and after the war it was called the Circle of Negro Relief, created the Blue Circle Public Health Nurses to address the high morbidity and mortality rates of Black communities that lacked access to care, especially in the rural South. Next slide, please. The Blue Circle nurses sought the same educational standards as their counterparts in the Town and Country, and they pioneered the delivery of public health nursing between the 1920s and 1930s in some of the rural communities in the South. Next slide. The National Organization of Public Health Nursing organized in 1912 as a result of the emerging specialty called public health nursing. Next slide. The most well-known public health nursing leader and organizer of the NOPHN was Lillian Wald. She was also known as the founder of the Henry Street Settlement House on the Lower East Side of New York and the architect of the Town and Country. Wald's work became nationally and internationally known as she argued for the provision of healthcare to immigrant populations, support of Black communities, educational opportunities for nurses, especially in public health, labor laws, tenement laws, playgrounds, and many, many more of the social reforms of the day. Next slide, please. Unlike the NLN and the ANA, where state membership barred Black nurses from participating, the NOPHN accepted Black members. And actually, the Black membership in the ANA and NLN had to do with the states that they came from, and many of the states prohibited the membership into the organization. But the NOPHN, on the other hand, accepted all Black members and nurses individually. The very premise of the NOPHN was that, quote, good health is an inalienable right of every citizen, man, woman, or child, unquote. Next slide, please. While nursing was organizing between 1893 and 1912, it had focused inward on professional development. But as these organizations matured, the voices of the many leaders turned to broader issues affecting the health of the public, including women's suffrage. Next slide, please. Yet the stakes for organizational suffrage and the support of organizational suffrage was really high. The nurses who opposed such suffrage did so primarily because of the fear of alienating the support of the male legislators in their struggle for state registration laws. Nurses in favor of the suffrage argued that without the vote, they were rarely selected to serve on the boards of health, nor had a say in legislation affecting the health of the children or the immigrants or the workers or the people that they served. And even they were unable to participate very often on boards determining the professional licensure of nurses. Next slide, please. By 1912, nursing organizations officially voted to support the suffrage movement, and their support continued right through the passage of the Women's Suffrage Amendment in 1920. Next slide, please. Nursing's history is filled with activism to organize, to set standards for education and practice, to demand healthcare access for all, and to move into the academy and educate safe practitioners. Yet the same history reflects the history of the United States, replete with racism, sexism, and adherence to the status quo of the time. Next slide, please. We cannot look at this history of great accomplishments without recognizing what Shirley Titus, director of the School of Nursing at Vanderbilt University, said at the National League for Nursing annual meeting in 1933. She said, quote, "Nursing is part of the warp and woof of the whole social fabric. Nursing cannot be isolated, a separated thing in itself. The flow and the interplay of social forces are inevitable," unquote. Now, this is why when we speak of the history of nursing, and it's an illustrious history, I believe, we must bear witness to the good and the bad, and yet seek ways in which we can stay true to the notion of providing health for all. While we cannot overlook some nurses' early wishes to stay neutral or even to oppose the women's suffrage, nor can we excuse nursing's participation in the Jim Crow laws of the South that created separate and unequal educational and practice opportunities for nurses. But through the study of nursing's history, the contributions it has made, and the participation in the social fabric of society, we can take comfort at its progress and perhaps learn from it. Next slide. And in conclusion, I'm getting there. Now, as we celebrate the Year of the Nurse, I turn to the latest edition of the American Journal of Nursing, founded in 1900 by the ANA and the NLN, for the recognition of nursing's contribution and the power the vote grants nurses to make their voices heard. In editor Sean Kennedy's words, quote, "This is no time for silence," unquote. Nurses through the ANA need to take a stand as an organization or as a profession, like we did in 1912, to reflect their values and beliefs about health for all. And in the words of the first editor of the American Journal of Nursing, Sophia Palmer, "Organization is the power of the day, and without it, nothing great is established." Next slide. Thank you very much. And I'm open for questions.
Thank you very much, Sandra. It was a real pleasure to get that history refresher. And, as we all reflect on the history we were just reminded of, for the end of our presentation, please keep in mind one question that we'd all like you to think about and contribute to a dialogue, which is, what are concrete ways the profession and you as an individual nurse can contribute to health equity? And so keep thinking about that as we go through the remainder of the presentations. And in terms of questions for Sandra, please type them in the chat, and I will field them either individually or thematically, depending on how fast you all type. Really? No questions?
Good. No, I mean, I told everyone no questions.
Well, all right then. If there is, we do have a question. From a historical standpoint, what traits or actions seem to advance nursing the most?
That's a very good question. And historically, I think reflection on our practice, reflection on our education, thinking about what we do is one way that we can progress, seeing what's going on in the world and how do we respond to that. So I think that it's an ongoing process. I don't think our history is done yet, and we have a lot to accomplish still, and we can learn from our history. So going forward, we can accomplish a lot by listening to what went on before, to study it, to critique it, the good and the bad. And, you know, that's something that we need to do. And that's part of our history. And that we reflect on it. So that's what my thought would be. And there may be other thoughts.
Great. And we have another question of, as we look back on the history of nursing, what are ways we can make changes moving forward?
Well, for me, and everyone on my faculty at Pace University knows this, that I would say study history. And I mean, really study it. Aside from just the dates and stuff, but really critique it. You know, there's many people are studying, you know, we have various centers, the Bates Center down at Pennsylvania, the center at University of Virginia, the Eleanor Crowder Center for the Study of the History of Nursing. In Teachers College, we have a lot of materials. Study the history, critique, raise questions about what's going on. Look at the pandemic today. What went on? And I have a student that's studying the history of the pandemic and what did Lillian Wall do at the Henry Street Settlement, for example, and understand why was nursing valued then? What did they do? What were the skill sets they needed? And how are we capturing that with our pandemic today? Take issues with what we're learning today. The systemic racism that we know exists. I have another student at Columbia who's working on diversity of faculty today. And she's looking back at, for example, Lincoln Hospital and the history of what went on at Lincoln Hospital. You had Black students and white faculty, for example. So to me, I guess I see the world through, I'm trying to understand history. That's what I would suggest, but there are other ways to do it as well.
Great. Thank you again for a wonderful answer. From Sue Hassmiller, one of our esteemed panelists. She poses the question, our past leaders were very involved with policy. How do we get this generation interested in and engaged in policy?
I think that's a question for everyone here. Beg, aside from begging. I think that when we look back, we see the people that are interested in policy and they were engaged. I'm not sure if we don't have people that are engaged now, and perhaps when we look back at some of the people today, we'll say, wow, Susan Hassmiller, Julie Fairman, for example, you know, so many people that are engaged. I think I saw Afaf Malise on it. People are engaged in policy. And I think, I'm not sure if having-
Sorry, I'll mute my microphone.
I'm sorry. Stepping back and looking at the past, we see things, they may not have realized how engaged they were. I don't know. I don't know how they felt. But so looking back at what we do today, I think many of us are very, very engaged in different ways. How do you engage students? Bring them with you, mentor them. Look at Paulie Joseph. She's can mentor millions and millions of people out there. She's terrific, right? I don't know everyone that's on this, video chat, but there are many, many people that are out there that I'm always impressed. We have students, that go up to Albany and their lobby day. So get our students involved, and I think that's a big place. Get our nurses involved, and then remember the history. We look back at what people did, and I think just see how many people can get involved in the future.
Great, and we have time for, I think, one more question, but it's this is a thematic grouping of questions, which is how do we acknowledge our perhaps sometimes less than stellar history in terms of our involvement with eugenics, segregation, while we're also moving forward to understand how that informs our professional identity and dismantling the structural legacies of that.
That is probably the big question of the day. And I think more and more historians are uncovering, Cindy Connolly, for example, is looking, I believe, at, and others are looking at how nurses participated in various research that might have been not as ethical as we would like, not having, we have a history. We're part of the warp and woof. I think that's why I loved, we're part of the social fabric. And every time I hear we think that we're just wonderful. We are. Nurses are the most trusted, the most caring, and all of that. But we also participate in we participate in Jim Crow South laws. I just interviewed Dr. Bernadine Lacey, and we published an article on her interview in the AJN. And she talks about growing up in the Jim Crow South. Well, nurses participated in it. Schools of nursing participated in it. Faculty said you don't have any business being that good. So one, we have to acknowledge that we have a history that has a lot of factors to it. And it's not all good, it's not all bad, but we must uncover it, because we will not have a diverse workforce today if we don't understand why, for example, at Lincoln Hospital, why did they just have white faculty and supervisors? Why, with the Ethel Johns report in the 1920s, it's unpublished at this point. It's at Rockefeller Foundation, the Rockefeller Archives. Darlene Clark Hines speaks about it. Nurses participated in racist thinking about, the Black nurses, Black populations, other various groups, immigrants, and so that we need to study it in a way that acknowledges it, critiques it, where we reflect on it, and hopefully we grow from it. And that we do have a belief. We have to look at what do we believe? Do we believe in healthcare for all? Do we believe in the culture of health, that where we live, work, and play really influences the kind of healthcare that we receive? So that, we all are on the same page. I look at it from historical perspective.
Great. Well, thank you so much for all of those thoughts, Sandra. We are going to move on to our panel presentation now. And it is my great pleasure to introduce a really stellar group of people from across the country. And they've each been asked to offer short bits of remarks to the attendees, and I will ask them to present in alphabetical order as listed on the agenda. And our panelists include today Sean Clarke, the Executive Vice Dean and Professor at NYU Roy Myers College of Nursing, my home institution; Jennifer Dohrn, the Associate Professor of Nursing and Assistant Dean of Global Initiatives at Columbia University. She's also a midwife. Susan Hassmiller, who I've had the pleasure of working with on the Future of Nursing report, who is the Senior Advisor for Nursing at the Robert Wood Johnson Foundation; Rear Admiral Susan Orsega, who is the Director of the Commission Corps Headquarters at the Office of the Surgeon General; and Edwidge Thomas, who is the Medical Director for Delivery System Reform Incentive Payment within the Mount Sinai Health System. So leadership across academia, industry, and the foundation world. So we will start today with Sean Clarke.
Thank you so much for the kind introduction, and I just want to start by thanking the organizers for the honor of being part of this illustrious panel. Just a tremendous opportunity, and delighted to be part of the dialogue. For those of you who can see me, I apologize for the bizarre headphones. I'm in a makeshift office at the moment, dealing with some family issues, and I just want to make sure that the audio was kept under control, but some of you will get a little amusement out of these really big headphones. So what does 2020 and the Year of the Nurse and Midwife mean to me? So, of course, the celebration of the work that nurses do and the global nature of our profession and its impacts. And, I also think, of course, of the role of our profession in social mobility for nurses and for their communities and so forth. And, these things are really, really important. But of course, I'm always, from basically, February onwards, the Year of the Nurse and Midwife is always going to be linked with 2020, the year that everybody wishes just would end. We've been hammered one thing after another, and it will always be linked with the coronavirus pandemic. And, I think that the COVID crisis, the pandemic, has pointed out the way that nurses' role in society is, sometimes dramatic, but often not. It's often not fully visible to the uninitiated. It's often unsung. But it's always vitally important. And nurses have this, very trusted status in society that we talk about, that we've seen manifest in different ways, including surveys that have been done over the years. On the call, as people were working out some of the technical details about the Zoom, it came up, just like nurses will always figure it out. And this has really been a year for the profession to shine, but maybe not in an especially flashy way. It's been a year where we've seen the importance of cutting to the important elements and sweating the small things, to thinking long range and big picture about impacts of things that are unfolding over time. The need for patience and the need to deal in facts and with facts as we move through the world, and to de-dramatize, I guess, whenever possible. And, so now we are still in the thick of it. We have not come to the end, but hopefully some of the celebration that we wind up doing in this year will be accompanied by the point that Dr. Lewenson was mentioning. Will our profession in all of its corners and all the places in the world get it right in terms of using our status and our wisdom and our places, our trusted places for the public good? Thank you.
Thank you very much, Sean. Jennifer Dohrn.
Thank you, Allison. I would like to thank the New York Academy of Medicine for giving me the honor of speaking tonight, and give deep gratitude to the thousands of nurses and midwives around the world whose paths I have witnessed and shared as they daily demonstrate the human right to health for all. I would also like to acknowledge my dean at Columbia University School of Nursing, Dr. Lorraine Frazier, for her wisdom and support. My dear colleague, Dr. Elaine Larson, who also believes in making my dreams come to life, and my family, my rock. When I think of the Year of the Nurse and Midwife, I think of our dedicated team of midwives at the Childbearing Center of Morris Heights, who opened with me the doors for hundreds of pregnant women and their families in the South Bronx. Black women and Latinx women and women from Caribbean countries in Senegal, Mali, Ghana, women who had been told they were too high risk to be at a birthing center simply because of their backgrounds in the community they lived in. We as midwives involved women in our advisory committee, in their participation, in their care, and walked with them and rubbed their backs and held them and encouraged them as they birthed their children, ensuring healthy mothers and healthy babies. I think of the midwives in Eastern Cape and KwaZulu-Natal provinces in South Africa, who in the early 2000s educated themselves about HIV, its prevention and treatment, and went door to door in their communities, coaxing pregnant women to come to the clinic to be tested for HIV, and then standing by them as they integrated HIV testing and care into antenatal care to give them dignity and courage, not stigma. The same midwives fought for 7 years for legislation and regulation approval so that they could initiate and manage antiretroviral treatment, which greatly increased the numbers of women on ART and reduced mother-to-child transmission by 90%. When I think of the Year of the Nurse and Midwife, I think of the nurses and midwives in Zaatari refugee camp in Jordan, who provide reproductive health and maternal care to the thousands of Syrian women forced to flee their homes and begin the arduous journey of building new lives. I think of the nurses and midwives in Liberia and Sierra Leone, who answered their country's calls to be on the front lines fighting Ebola. Nurses who gave their all, from buying their own personal protective equipment in the early stages, marching the streets in Freetown. Here come the Ebola nurses, the community would shout, to bring stigma, reduce it, teach about it, and teach the community safe burial practices. And being there as their colleagues died from Ebola, from Dr. Emmanuel Khan, chief infectious disease expert, to their co-workers in the Ebola treatment units. I think of the nurses in New York City who stepped forward shift after shift during the chaos and brutality of COVID-19 in March and in April and in May. There had been no preparation for pandemic response and great fear of infection, as over 800 people were dying daily in our state. Yet they went back every day and every night, learning and practicing infection prevention control, comforting people and families and each other, and forming stronger and flexible teams with doctors as shared responsibilities and actions became essential for effective response. And I think of the nursing students whom I've had the honor of teaching over 3 decades, teaching midwifery, teaching global health equity and the responsibility of the nursing profession to tackle health disparities and injustices across countries and regions and become agents for change. This is their year two, a time when we can rightfully claim our central place in providing safe, quality care to all. When Dr. Tedros Ghebreyesus, Director General of the World Health Organization, appointed Ms. Elizabeth Ebro, a heroic nurse and midwife, to the Leadership Council within the World Health Organization in 2017, the door was pushed open for nursing to be persistent, to have our voices at the policy table. Mrs. Ebro told us in a meeting shortly after her appointment that we all had to collectively be part of this voice with our knowledge, experience, and evidence to ensure the most effective policies for the world's population. With this year of the Nurse and Midwife, we have the opportunity to showcase to the healthcare team, policymakers, and the public that nursing has always been and will continue to be on the front lines of providing quality care to communities everywhere. To the more than 85 million people enduring forced migration, to those without access to quality care for non-communicable diseases like cardiovascular disease, diabetes, and cancers, to those suffering from mental health issues and instead of being treated with compassion and care, find themselves stigmatized and abandoned, and to those caught in pandemics such as we witness today. This year of the Nurse and Midwife is a call to action for policymakers, other healthcare professionals, and the public, that we, as the majority of the health workforce and the critical connection to the communities we serve, are to be heard, consulted with, recognized, and included. We are steadfastly clear that, as the African proverb reminds us, if we want to go fast, go alone. If we want to go far, go together. We as the nursing profession want to go far.
Thank you very much, Jennifer. I'm now going to turn the moderator duties over to my co-chairs and co-conspirators for the NYAM nursing section, Maria Vizina and Toby Bressler, both nurse leaders in the Mount Sinai Health System.
Thank you, Allison. We're going to ask that same question of what does 2020, the year of the nurse and midwife, mean to you, to Edwidge Thomas to give us her response.
Hi, I want to begin by thanking the New York Academy of Medicine for inviting me to this panel. And I look around and I see nursing colleagues that I have admired throughout my career, not only as panelists, but also as attendees. What a year for nursing and midwives to be recognized. Although 2020 is the year that will be chronicled in history as the worst pandemic ever, how fitting is it that the World Health Organization selected 2020 as our year, unknowing of what it would represent. You've already heard from my colleague that presented the history of nursing, is that nursing at our inception was at the forefront of infection control and prevention, led by our fearless leader, Florence Nightingale. When we fast forward to 2020, the year of the nurse and midwives, nurses again are at the forefront of caring for patients with a horrible virus, COVID. The care that nurses are providing with incredible dedication, incredible warmth and compassion as they are facing the constant danger of potential exposure. While caring for their patients' clinical needs, nurses understand the criticality of connecting their patients with families, with their dying loved ones, and the remaining with their patients that they transition so that these patients do not die alone. Nurses are selflessly exemplifying the role of nurturer, healer, while adding valuable contribution to the evolving science and treatment of COVID. I am so proud and in awe of how nurses of all stripes and roles, whether at the bedside, in the ED, or in the ICU, or in the administrative roles, even our retired nurses, all pitched in to help our patients and one another to weather this incredible pandemic. I have never been so proud to be part of such an amazing profession that exemplifies the science of human caring and yet provide all of us with boundless opportunities. My 34-year career have led me down various paths and some non-traditional nursing roles in nursing. As a nurse first, my approach to everything is through a holistic lens, the lens of human caring, the lens of respect and dignity, with a keen understanding that every aspect of one's life and lived experience can impact one's health and health outcome. my nursing foundation taught me to continue to contribute to the nursing science, education, research, and practice by uplifting all who I encounter and make them feel valued and do my level best to support, whether it is a patient, a student, a fellow nurse, or a colleague on their journey to better health, self-actualization, or search for their better selves. The celebration of 2020, Year of the Nurse and Midwife, has such a special meaning for me and so many other nurses like myself. I've been very reflective of what nursing means to me and to so many others. Two critical facts come to mind. Nursing is one of the most trusted professions, and nurses are the largest workforce in healthcare. How do we leverage those two facts and propel our profession further to the next decade? COVID has thrust nursing into the national and international spotlight, and it's affording us some amazing opportunities that we need to leverage and seize the moment. I encourage my fellow nursing colleagues to consider and plan for the following. Our training in understanding the human condition and experience and the fact that we are trusted by the public makes us such great candidates for office. You heard from our colleague earlier that nurses make incredible candidates. And when I think about nurses and how talented we are, how well-educated, how energetic, and the incredible appeal that we have, we need more of our nurses at the legislative table making decisions that impacts our communities, our state, and our nurses, and our nation. Nurses should run for office. I also look at the fact that we're the largest workforce in healthcare, and yet our numbers are not reflective in positions of executive leadership. I encourage nurses with years of hospital experience as administrators, have incredible track record of success, whether it's leading a hospital to achieve a magnet status or leading nursing teams to practice at top of the license and deliver high quality care. I say to all my nursing colleagues with those experiences, lean into the challenge and apply for those C-suite positions. We need more nurses at the executive positions in hospitals, pharmaceutical companies, and other related health organizations, where most of the strategic decisions are made in healthcare. Nurses need to be at the table. This is our year. I encourage our nursing academic institutions to leverage this time to re-examine our curriculum and training sites. We need to ask ourselves, are we adequately preparing our future nurses to meet the demand of our extremely complex patients with comorbid conditions and the challenging social circumstances that COVID has highlighted? Our hospitalized patients are sicker, and our patients in the community, regardless of the setting, are sicker than they used to be. Patients need to be cared for nurses operating at top of license. Lastly, I'm going to borrow from IHI. The goal of healthcare is to provide the right care in the right setting at the right time. Nursing is at the center of all healthcare. As more patients are in desperate need of high quality, comprehensive primary care, with the regulatory barriers that prevent advanced practice nurses from delivering care independently, I am hopeful that this year that we are shining and that we've been highlighted as being at the center of nursing, at the center of healthcare, that this movement and how trusted we are and how we're the largest healthcare workforce will propel a lot of the changes that are needed to be able to get a lot of our legislators and some of our states to move our advanced practice nurses to full practice authority throughout the country. Thank you so much.
Thank you, Edwidge. We're going to ask the same question. What does 2020, the year of the nurse and midwife, mean to you? To Susan Hassmiller.
Good evening, everyone. It's a great pleasure to be here, and it's an honor to be on this panel. I was flipping through the pictures earlier, just looking to see which colleagues I really miss hugging and being with, and I'm so glad so many are in attendance. And I know one of the things that you asked us to do as we introduced ourselves was to mention why we went into nursing ourselves. And I just really wanted to pay tribute to my mother, because it was my mother who was a Bellevue graduate, and Sandy Lewenson helped me do a historical piece on my mother, published in AJN. I just lost her last year. So it was really my mother's great guidance. She never told me to be a nurse, or you have to be a nurse, but by role modeling, by coming home in that starch white uniform and those stockings and that little Bellevue hat, and visiting her in the hospital, I really saw firsthand what a nurse did. Also, I wanted to pay tribute to my mother, because she was one of the, when she graduated from Bellevue, right after that, the tuberculosis epidemic was coming about. And she was one of the first nurses to volunteer to be part of that nursing care for the tuberculosis epidemic. She flew in a propeller jet all night long to California to take care of people in the iron lung. So on behalf of my mother, I am thrilled to be here. So the year of the nurse, and I have to say too, you know, as a senior scholar in residence and senior advisor to the president on nursing at the National Academy of Medicine, working on the next Future of Nursing report, this year has been not at all what we thought. In fact, the report, the new Future of Nursing report, that was to be on how nurses address the social determinants of health and health equity. That report was due to come out at the end of this year, but because of everything that happened between COVID and George Floyd and everything, we had to stop the presses, and we couldn't, in good faith and conscience, deliver a report to the field that didn't mention and pay homage to what was really going on this year. So that report will now come out at the beginning of May. So what does the year of this nurse mean to me? The year of the nurse and the midwife was intended to spotlight the often unheralded but vital contributions of nurses in providing health services and their unique role in caring for the whole patient. But the COVID-19 pandemic has shown a light on the compassion, dedicated, and voice of nurses in a way few could have anticipated. And this is how I feel, and I know a lot of people feel this way. I've never been prouder to be a nurse. Yes, we do feel that way, but I've never been more outraged to be a nurse either. And how many nurses have been forced to care for patients without the proper equipment to keep them, their loved ones, and their patients safe. Nurses are giving it their all to save as many lives as possible. You know, starting in the ER and the intensive care unit, palliative care, and now in public health and school nurses, and how everyone in our profession, care coordinators, has really just risen to this occasion, many times risking their own lives and the lives of their loved ones to do so. Far too many nurses have become sick and lost their lives because the United States government failed to procure the necessary personal protective equipment to keep them, their families, and their loved ones safe. And this whole thing has been abominable and totally unacceptable to me. We will just await the lessons that come out of all of this. The pandemic has also laid bare, which is really important to me in the report that I'm working on, the pandemic has laid bare the racial and health inequities that have persisted, yes, across our generation, and the nursing field needs to prioritize and be part of that solution now in addressing health equity. If nurses before had never heard of the word social determinants of health and health equity, I think they have now, and they really have experienced firsthand through their care who is living and who is dying and who is getting sick. The year of the nurse and the midwife has brought newfound attention to our work, and at the same time that catastrophic world events, the pandemic and climate change and everything that's happened around racial injustice have stalled decades of global development in everything from health to the economy. Nurses will need to be part of the solution in rebuilding and reimagining our world. And as many of our panel members have mentioned so far, there are ways of doing that. We've got to be at the table. We have got to be involved in policy and those upstream factors. We know that there are nurses working on downstream factors, but we've got to be working on policy as well. Thank you.
Thank you, Susan. And now we'll turn it over to Rear Admiral Orsega.
Good evening, everyone. It's an absolute distinguished privilege and honor to be here with all of you. And a big, really a big thank you to my peers who really have highlighted a lot of components that really speak about where we are for nursing in 2020. I actually just want to take a moment and acknowledge Dr. Hassmiller's mother, because her mother was one of the cadet nurses. The cadet nurses, if you don't know who those cadet nurses were, I encourage you really to take a look at what they've done, because they were frontier women who leaned forward in a space and a place where nurses were essentially had a back seat, but they found ways to lean in and be pivotal leaders on their own accord, from whether it was Dr. Hassmiller's mother flying in a prop engine plane, or whether it was individuals who were on the front lines dealing with tuberculosis, taking care of individuals coming back from the war. This was the largest federal training program. I was the 11th chief nurse officer, and the very first chief nurse officer, Petrie Leon, really garnered the confidence from the Surgeon General at that time and made a convincing, compelling argument to make that statement of you need to have to begin to train nurses. And to date, unfortunately, we haven't replicated what they did, which was built one of the fastest training programs. Nurse graduates did things that I hope we, if you haven't, as you're reflecting during this time, take a moment to take a look at what they've done, because they shaped history and really were similar in respect to all of the predecessor nurses that we've had over in the forefront of our career. One of the things when I think about where we are, and as I was preparing for today, I was thinking, as we look through the year of the nurse, what things have we done to get us to 2020? And for me, I start to think of, is it our educational? Is it the expansion of advanced practice nursing? I'm a nurse practitioner. Is it the being able to build and develop programs and partnerships and collaborations in areas of the country and in areas of the world that didn't have nursing programs, like one of my colleagues on the panel mentioned, in Liberia, in South Africa, in Mali, in places where I worked. Is it areas that have not been able to, of our country, that just have been so disenfranchised to receive care, but now are afforded to get the same level, the same type of treatment that those that have insurance in areas along the Appalachia or areas in our Indian Health Service reservations? All of those things come to mind. But then, of course, 2020 in January, when, at least for me, when I became very much aware of the events that were unfolding in Japan with the Diamond Princess cruise ship, I learned and realized that This was a moment where, as they were looking for individuals to deploy over to assist people that were on that cruise ship to come off and needed either to receive care or to be able to do screening, that we needed to get nurses over there along with the other science counterparts. And I would never have predicted that as the weeks went by and as the months went by, and still today, where thinking New York City, for example, right now is in the yellow zone in terms of the number of cases, and in the green zone in terms of positivity rate, which is an incredible change from what happened in April. But we're swinging in an upward trajectory again in terms of COVID. And so I hope that we can think about not only these tools that we get in education, but moreover, sort of the tools. It's not the stethoscope, it's not the reference books, it's not the books, it's not our iPhone, but I hope that we think about our logic, our intellectual, our leadership tools, our collaborations, whether it's within the nursing communities or it's interdisciplinary, and leveraging those tools, because that's what's going to help us into the fall, into the summer of 2021. So in closing, think about this year as a dynamic shift, moving from what lessons we learned from those nurses who came before us, so that we can be nimble and move towards being solution providers and developing solutions, particularly with COVID increases into the fall.
Thank you, Rear Admiral Orsega. Our next question is, 2020 has been an impactful year with a global pandemic, the Black Lives Matter movement, police brutality, and national protesting. Our question is to Edwidge. How do you envision the evolution of nursing within this context?
So I want to thank you for that question and really applaud you for recognizing that remaining silent on that question more specifically could be perceived as ignoring the elephant in the room, and it's no longer acceptable to do so. You know, as I've watched the events unfold, as many Americans have, whether it's looking at Ahmaud Arbery murdered while going for a Sunday run, as many families do, as my family have done on many occasions, Amy Cooper calling the police to falsely accuse a Black man of harming her, knowing the consequences that it could lead to, Breonna Taylor, who's an EMT, murdered in her home on a botched police raid. And then you have George Floyd murdered by a heartless police officer for all to see. And Jacob Blake and countless others. Although these devastating events have all occurred in the last 8 months, it really still feels like it was yesterday. I think I can safely say that many of us have experienced some of the stages of grief these past few months. And I didn't spend that much time denying, because the anger and the rage and the dismay was so palpable. But I have to say that I'm really encouraged and hopeful by the Black Lives Movement, who have galvanized so many people, so many groups of different races and background to peacefully protest and demand change. We as a nation have a long way to go, and we all know that. But I do believe that many have come to realize that Black lives matter too, because it hasn't for so long. As for nursing, nursing has always been at the forefront of health equity. Nursing has always been in the poor, marginalized communities and rural communities and drug-infested high crime communities, caring for those who are marginalized, who are forgotten. Nursing has always been the profession that believes and espouses that everyone have the equal opportunity to achieve the fullest potential of optimal health, regardless of one's race, creed, color, religion, or sexual orientation. I'm well past feeling depressed about the state of race relations in the US, and I'm on to what could we do, what could I do, what could nursing do to support the journey towards equity, inclusivity, and justice for all. I recognize that these conversations are difficult as we're all having them with each other. As we, Black, and brown folks are enlightening our colleagues and our peers of our lived experience in a Black and brown skin. I do believe this is a perfect time for us in our nursing profession to re-examine our current state in academia, in practice, in leadership, in research, in all of our associations. A position statement on a website without clear and measurable objective goals and outcomes, without a timeline, is no longer acceptable and it's inadequate. I believe that all nursing institutions and healthcare institutions need to commit to an action-oriented plan to address anti-racist policies, behaviors, and attitudes in our learning and working in social environments. Academia need to commit and have a plan for addressing anti-racist behaviors by integrating anti-racist perspectives across all curricula, teach the concept of race, and using it accurately in all levels of nursing education. I also believe that academia needs to think about how to provide culturally appropriate support to Black and brown, and all students for that matter, who themselves may have unmet social needs and require support and mentoring as they continue their educational journey. Academia also needs to address the disparity in faculty and researchers of color as well, and commit to investing and supporting talented Black and brown nurses to achieve the same level of success as their white counterparts. Lastly, our healthcare institutions like our hospitals, our clinics, and nursing homes. I urge you all to look around and examine whether or not your leadership is representative of your nursing workforce. I can assure you that in many instances it is not. I hope that this time of awakening awakens you, all of us, to think about and develop programs to support the talented, well-educated Black and brown nurses among you to achieve senior and executive positions as their white counterparts. I really thank you for giving me the opportunity to share with you so openly my thoughts and my vision and how I think that nursing could really make a difference in this time. Thank you.
Thank you, Edwidge. Thank you for those beautiful words. Our next question is to Rear Admiral Orsega. Can you share with us an experience where you wished you had done something differently to advance the image of nursing? Can you share with us a time where you may have missed an opportunity to place nursing or nurses on the map?
Yeah, thank you very much. Prior to my role as here as CCH, as a United States Public Health Service Director for deploying officers, I worked at the National Institutes of Health and the National Institutes of Allergy and Infectious Diseases, and I was really fortunate to have an incredible opportunity to help establish clinical research operations in international countries. And as part of that role, I set up operations in West Africa and particularly in Mali. And that country, when I was assigned to that country, I was establishing research collaborations. And I think for me, as I looked at that country and saw the role of nurses that really weren't on the forefront, really of leadership roles. So I, as the chief nurse at that time, what I did was went to an International Council of Nursing meeting, and I think it was probably the last year before my term ended, and I wish, and I sat back and I looked at all of the nurses, the senior leaders in that audience, because it's convened by the International Council of Nurses, and they convene the chief nurses and the chief regulators across the world. And when I sat and looked, I had looked and realized that Africa really wasn't representative, other than if you were a Francophone country. You weren't, and even in West Africa, there wasn't a lot of representation. And I had an opportunity because I was working in Mali, I had worked in Liberia, worked in Sierra Leone, and I thought to myself, why didn't I think about this before? Here we're talking about collaborations and building partnerships and capacity building. So while I didn't do it earlier, and I regretted I didn't, I was able to talk with the chief Ministry of Health representative, who is equivocal to like our Secretary of Health and Human Services, and made a case of why nurses really needed to be at the table for decision making, both in the country and the value add of having someone at that table for that meeting. So sure enough, that meeting was happening, and the Mali nurses were there. And I, at that point, I said, reached out to my colleagues who were working in Liberia and Sierra Leone and said, we have to build the space, because this helps them establish that network, just as we have a network right here. That connectivity is really powerful, and that voice gets larger. So that is one opportunity that, while it wasn't completely missed, I wish that I would have done it a lot earlier.
Thank you very much. I'm going to ask the same question to Sean. Can you share with us your thoughts?
Awesome. Thank you. Thank you so much. I'll take a different tack on the same question. You know, I think the question makes a really important point. It's what we do as nurses when we are in groups that are not dominated by nurses, I guess. And my socialization into nursing was a very warm one, I guess. You know, like feeling integrated into a community of practitioners who basically, you know, even if I was very different in terms of my background from them, as long as I expressed the same commitment to patients and a willingness to learn, they sort of embraced, I felt embraced, I guess. And I'm very grateful to have had that experience. I know not everybody has that experience. Now, as an administrator, I make it a point to work towards creating a more inclusive environment for students and for faculty. If I could sort of talk about, like, you know, sort of a missed opportunity, I guess, it kind of goes back to sort of some settings when I sort of moved, when I was a nurse, but I was sort of moving out from interacting mostly or exclusively with nurses to being in environments where I was working with researchers and fellow students from different disciplines. And, you know, I felt this desire to sort of blend in with everybody else, you know, when it was a room of people, you know, epidemiologists and sociologists and people from other health professions, and not to so much declare myself as a nurse among those folks. And, you know, it's really critical that we use every opportunity we have to make it clear to folks that we are proud of this identity, we're proud of the work that everybody in our profession does, regardless of the role, that our experience as nurses imprints the way we look at the world, gives us opportunities for solution to put forward solutions that other folks don't have, and that we are secure in our identities and don't need to demean others and their work in order to put ourselves forward. And so I'm really pleased, and perhaps it was a good thing that this sort of transformation and realization happened about being proud and sort of declaring myself to be a nurse in these different settings and explaining how, you know, my clinical training was as a nurse. I might do research, uses quantitative methods and get involved in health policy and all these things, but I am first and foremost a nurse who spent a big chunk of my career educating nurses, setting up environments where nurses can teach and learn from each other and trying to get the best faculty in front of students possible. And that this is, you know, that's by my example, me among an incredibly diverse range of people, you know, we are here. We deserve a place, as others have said, in public policy circles and elected office, in boardrooms. That there's really no need to want to blend into the background, despite things we may feel, you know, insecure about. Thanks.
Thank you so much. Our next question is to Jennifer Dohrn and Susan Hassmiller. We have all seen nurses rise to the occasion during this pandemic. Now what? What do you think it would take to continue and sustain this newfound social visibility of a nurse and a midwife as a valued caregiver? How do we package this progressive recognition and maintain the momentum? Jennifer?
Thank you. Our collective nursing response to this COVID-19 pandemic globally shows with crystal clarity that we are right there, going to our jobs day after day, often without adequate PPE, redeployed to different units, witnessing unimaginable amounts of suffering and anguish and dying, and being a vital part of the health team response. During this year of the Nurse and Midwife, we have become known everywhere for our sacrifices and service, shown, for example, by the banging of pots at 7 p.m. in New York City and many other sites across the globe, to the multiple stories now on media. One nurse whom I interviewed told me as he left NYP ICU shift and found people cheering him, I felt acknowledged. I kind of felt like a hero for a moment. But let's go deeper. We are also providing the evidence of what needs to be done going forward, especially at leadership levels. An example for you to consider are from the nurses and midwives in Sierra Leone and Liberia in their Ebola response. And recorded and analyzed oral histories provides evidence of what are critical components for effective pandemic response. One, it's critical to have knowledge about and access to infection prevention and control measures. Policy recommendations must include dissemination rapidly of knowledge about and access to infection prevention control for new outbreaks to nursing cadre and the enlarged health workforce. Two, teamwork was redefined and changed during the pandemic response, and it was done without effective compromise of quality of care. Again and again, hearing stories of how people donned personal protective equipment and removed them as a team, making sure each of them was completely safe and their lives were in each other's hands. Nurses in New York City taking much larger roles in managing ventilators and medications within their capacity and being recognized in a different configuration of healthcare teams. So policy recommendations must include redesigning of the framework of healthcare teams and their responsibilities with inclusive and flexible roles to maximize our competencies in response. Three, nurses gave vital information, education, and care to their communities. Policy recommendations need to designate and capacitate nursing cadre as the link to the community for engagement and education about transmission, prevention, treatment, respectful practices for community values and beliefs, and mobilization. There is no effective response without an engaged community. Four, nurses witnessed great suffering and death amongst their colleagues, their families, their communities, resulting in mental health and emotional distress. Policy recommendations must include the provision of well-being services, physical and mental, emotional, to all cadres of the healthcare team during pandemics and afterwards. Five, nurses expressed dissatisfaction with the lack of acknowledgement for their service and sacrifices, physically, publicly, individually. Policy needs to include standardized recommendations to recognize nurses' contributions and sacrifices in these areas. And six, nurses wanted more involvement at leadership and policy levels. The way forward needs inclusion of us at top levels in policy development, guidelines, and implementation of strategies for prevention, containment, treatment, and recovery. We have the expertise to make this change. Arundhati Roy, who's an amazing Indian poet and activist, wrote, the pandemic is a portal. It opens us to see chasms and deep ruptures within our society and across the globe. Inequities of healthcare systems, including exclusion and racism. It also opens to see what exists, its strengths and its challenges. This offers opportunities for change. Globally, the pandemic allows us to see the potential and necessity for expanded nursing roles. It has created visibility that our experience and evidence and leadership must inform recommendation for policy. Our guidelines need to be included in all professional health guidelines, not only nursing organizations. As Ruth Bader Ginsburg said, women need to be at the table where decisions are being made. I think she'd be okay with me paraphrasing this to say nurses belong in all places where decisions are being made. We as the nursing profession do recognize each other globally at the International Council of Nurses, the International Confederation of Midwives, the global network of WHO collaborating centers, and Sigma Theta Tau International. We are recognized by the communities of people we serve. Now we must continue to expand our rightful place to be at the policy level, nationally, regionally, globally, and to be recognized by other health professions that we deserve to be at the table. The Year of the Nurse and Midwife gives us many platforms to say this over and over again. When teaching students, when holding events, when speaking to the public and to the media. This is our year, and this is what we do with courage, sacrifice, best practices, as it is our ethical mandate. There is no more time for missed opportunities when so many lives have already been lost and are at stake. We need roadmaps for pandemic response that build healthcare teams with all of our members being supported to contribute at our maximum level and every member of society receiving equitable and just care. We will continue to push the door open, and nursing is ready to take our place.
Thank you, Jennifer. Susan, can you respond?
Yes, thank you. So nurses appreciate, of course, that their vital role is being seen during this crisis, but that doesn't automatically translate into the kind of support we need to care for patients. We need to make sure nurses are being sufficiently supported in their current roles before we ask them to do more. It's really important. Many nurses have worked long hours without the personal protective equipment necessary to keep them, their loved ones, and their patients safe. Others have been pulled into COVID-19 floors during surges without adequate training to care for patients. Some administrators have reprimanded or fired nurses for speaking out about their concerns over patient safety. We need to make sure we are meeting nurses' emotional needs. That's really important. One of the major lessons to come out of the pandemic is the need to address systemic racism and other isms and their impact on health. Nurses, as the most trusted health professionals, are natural advocates for our patients. We have an understanding of the root causes of poor health, and our strength lies in providing preventive and primary care, taking us back to our roots, as Dr. Lewenson pointed out. Many nurses already are responding to the pandemic with advocacy and innovation. There are lots of awards coming out, lots of innovations that are being presented. Nurses are also addressing health equity. They are, but we need nurses to take on bigger and better roles in health equity work. We need to use our newfound social visibility as a valued caregiver to act to address the social and economic factors that affect health and to partner with others outside of nursing and outside of healthcare, both within and outside of healthcare. We should be working to make sure that all health facilities integrate social needs in healthcare and advocate for community-based resources and case management to better assist vulnerable populations. We should be speaking up when speaking up matters, and we should join policy and advocacy efforts to improve health at the community, national, and international levels. And many nurses already are. Nurses throughout the country are serving on their states' reopening committees for schools, and others are serving on their community school boards. And last thing, I think I want to mention that there were a small group of nurse leaders, and I was part of that group, who were concerned over the winter and into the spring that nurses' voices were not being heard. We weren't getting the visibility, the kind of visibility that we needed. And so we started an organization, and you can go to this, called nurseseverywhere.com. It's not another nursing organization or association, but the goal of this group and this organization that we're now turning into a 501c3 will be for the benefit of public information, where nurses are the providers and the leaders and the trusted conveyors of information. And we have done our first Harris poll. If you go to our website, you can see what we did there, and we're working on our first PSA now, and we're putting together finally a piece on our website called Ask a Nurse, where the public can write in And we hope to start with school nurses because we know that's the biggest concern out there in our communities now. So we're trying to meet the public's need through nursing leadership. Thank you.
Thank you, Susan. We're going to open up the chat box to questions that you may have. And we already have 2 questions. Maria?
Sure. So Susan, Sandra Lewenson, sorry. We have a question here that speaks to, are the lessons we can learn from the history of nursing and from nurses in other parts of the world who were more inclusive, who were activists, and how connected women issues with nursing issues? Are there lessons we can learn in the history? So
Was that
Dr.
for me? I'm
Macy.
sorry. Yeah.
Yes,
you,
that's for
sorry.
you.
Absolutely.
2 questions, actually.
And thank you for taking off your mask.
You're welcome.
Keep it on, but when you're asking questions, take it off.
I know.
And I'm sure we can, I do think that, and let me see if I have the question. Are there lessons we can learn from some of the issues related to women's issues in nursing?
Yes.
Yes.
And yes, there are certainly lessons. And someone in the chat had raised the question about gender issues with men in nursing as well, that experience tremendous.
That one's for you too.
Oh boy, oh boy. How long do I have? I don't have any slides for that, but yes, gender issues are really important, whether you're a male or a female, whether you're black or you're white, which are not gender issues, it's part of it, but there's bias, and we do learn a great deal. So nursing historically has been closely associated with women's roles. And so that in women's roles, and the suffrage is where I looked at early on when I began my historical research, was looking at how closely aligned we are. And some of what I see, being at the table, for example, being like part of different boards, has to do with the way women in general have been treated over many, many years, as well as then nurses, because of their relation, their close ties with being the feminine role, for example, I think have experienced the disenfranchisement of their role on different political roles on boards and in different settings. So there is a connection. What we can learn is one of the takeaways for me in terms of organization. Power is is gained through organization. We have 4 million nurses, as Sean Kennedy wrote. We're 4 million nurses. Where is our vote? And yet we all don't have one way of thinking. In one of my classes, I was very surprised when I was advocating for immigration and some policies, and a student raised her hand, and she was an immigrant from another area. She was had a whole different view on what I thought should be equitable, fair treatment of immigrants. And so that we have to recognize that we are part of a large group of women, and yet we have different views, and we do learn from the past. And I think that we do need to have a voice together and harness that energy in any way that we can. So that's one of the lessons.
Thank you very much. The next question, this is for Susan Hassmiller, and this is the question. Can someone speak to the almost inevitable future landscape of so many rights in jeopardy that have a direct connection to nursing? Women's rights, healthcare rights, racial equity, and climate change, and how we must anticipate our legacy of advocacy for change in the event that the rights we fought for become fractured. Can we learn from our past how to be prepared to become active? For Susan Hassmiller.
I happened to see that question, and I was thinking, boy, that question should go to everyone. So I hope everyone on the panel can really chime in. But I looked at it very quickly, and the first thing that came to my mind was we have to start with our own passion. Sometimes students and young nurses ask me, how do you be a leader? Well, it all stems from, what are you most interested in? What are you most passionate about? If you're most passionate about climate or women's rights or racism, I don't think you can be all over the place. Being all over the place doesn't work. I think if you can get connected, know your own passion, figure out who is a leader, who are the leaders that are addressing that particular passion, and get connected to them. And if you're young, ask to be mentored, ask to just walk right in, ask to be connected. And I think that would be my very quick answer. And, mentoring is so key. I'm very fond of saying, if you're going to an important meeting, always make sure you bring someone half your age. Now, I fully realize that works for me, and it doesn't work for everyone. If you're a 35-year-old, it wouldn't work for you. But I take mentoring. I know one of my mentees, Ani Bilazarian, is I saw her. She texted me earlier. She's on line tonight. So I take mentoring very, very, very seriously. I pay more attention to students than I do to anybody.
Thank you so much. And right now we're going to turn over the podium to Elaine Larson for the next part of our presentation and event.
Sure, we're just about out of time, and Dr. Kenya Williams will do some closing remarks. But before that, we've been talking and celebrating sort of the nursing core role in the healthcare system. But despite all the good things about our system, our healthcare system is costly, overly costly. It's siloed, it's uncoordinated, it's wasteful, and it's inaccessible to many people. We can't solve these problems by ourselves. No profession can do it by ourselves. So I'm delighted that Dr. George Thibault has agreed to give us a 3 to 5 minute greeting on behalf of other professions and to talk about the role of nursing in interdisciplinary teams. Many of you know him. He's been a friend of nursing for his entire career. He was on the board of the New York Academy of Medicine for years. But for those of you who don't know him, I'll just introduce him briefly. He's the past president of the Josiah Macy Foundation. He served as vice president of clinical affairs at Partners Healthcare System in Boston, the director of the academy at Harvard Medical School, and he has been chair of the board of MGH Institute for Health Professions, among many other things. So George, thank you for joining us and for hanging in there through this whole conversation.
Well, thank you. I love the conversation, and I hate to be the stopper of this wonderful, rich conversation. But thanks for the honor of inviting me to help celebrate the Year of the Nurse and Midwife. It is a particular honor for me to take part in any nursing activity, and they're some of the greatest privileges that I've had. And it's also great to return home to NYAM. I can't help but start my comments by making some reflections on what I've heard, which has just been wonderful and uplifting. Firstly, history, which is so important. We need to be grounded in our history. Remember that Florence Nightingale taught all of the health professions the importance of bringing measurement with compassion to the bedside. And only with both can we really advance care. And the reminder that nurses have been involved in the broad social issues of our society from the beginning of the profession. And now, as everybody has given wonderful testimony, it's a time to both take advantage of that and accelerate that. I'm moved by the testimonials of all of the 5 panelists, both their vision, their passion, and their sense of commitment is just inspirational. But during my decade-long tenure as the president of the Macy Foundation, we brought forth a strategic plan to better align health professions education with the needs of the public. And central to that plan, in fact, the single largest investment we made to accomplish that alignment was in interprofessional education. That's based on the fact that there's an increasing body of evidence that care delivered by well-functioning teams leads to better outcomes. And of course, as already has been alluded to, the experience in COVID has just given us example after example of that. But in spite of that evidence, our traditional health professions education kept people apart, and you would not know that we were preparing them for teams. So we set on a plan to be sure that all health professionals would have some interprofessional experience, and that team-based skills would be regarded as essential to providing excellent care, as is the knowledge of anatomy and physiology. And I'm pleased to say that over a decade, with this investment, we didn't invent the concept, but it became now expected. And in fact, now all of the credentialing bodies of the health professions education require some interprofessional education. We felt from the beginning that nurses were central to that. In fact, every one of the projects that we funded included nurses in nursing schools. That we could not bring about this transformation without the single most numerous health professional and potentially most influential health professional as part of the team and as part of the effort of transformation for both interprofessional education and collaborative practice. But more than that, we saw it as central to our role to promote nurses as leaders, and that was brought up by many of the speakers, and I resonate with that. So nurses became leaders of our Macy conference. We advocated for expanding practice for nurses. We advocated for increased role of nurses, both RNs and advanced practice nurses in primary care. And our Macy Faculty Scholar Program, our signature program to catapult the careers of mid-career educational innovators, has had a high percentage of nurses. More than 40% of the Macy Faculty Scholars have been nurses from the beginning. So that is really our testimony to the centrality not only of teamwork, but to the centrality of nurses to the success of that team. Now, in spite of the travails that we've gone through in this 2020 year that have been spoken about and experienced by all of us, I am cautiously optimistic about the future. And I'm optimistic because of the wonderful opportunity I had over the last decade to work closely with nursing leadership across the country, to see the emerging role of nurses as leaders and problem solvers. We will not be able to address the issues that are confronting us today, the issues of social inequities, the issues of racism, the issues of a poorly functioning healthcare system, if we do not fully take advantage of all of the talent that we have within the nursing profession, starting with student nurses, with advanced practice student nurses, to clinicians, to researchers, and to leaders in nursing. That I've written the fact that we will not ever have a healthcare system that fulfills the needs of the public if we do not fully utilize the capacity of nurses to not only give care, but to lead. So I'm inspired by the words that I've heard here, honored to be part of this celebration. And I wish you all well, and I look forward to continuing to work with you in the future. Thank you very much.
Thank you, George. And Kenya, you can wrap us up here.
Okay, thank you so very much. Colleagues, thank you sincerely for joining us tonight. I will wrap us up with closing remarks and keep us close to the time that we need to depart. But I think our colleague Jessie really summed it up for us in her statement, where we learned a lot from our past. We need to celebrate our profession. We need to prepare our future nurses how to cope with all these pandemics, racism and climate change, etc. Again, I echo the importance of taking a young nurse, a young student nurse, and mentoring them both genuinely and purposefully to be staunch advocates, to be what we need to see, the future. And Priscilla, your comment, if we are not at the table, we are on the menu. And so this brings the link that I posted there, and I think about how can we as nurses continue to be advocates. And how can we continue to serve the communities? And that is by being active on governing boards. So help us, the Nurses on Board Coalition, reach this very pivotal point that we are trying so desperately to get 10,000 nurses on boards. And lastly, use your voices. November the 3rd is right around the corner, and that will be a strong statement that everyone can make by just simply voting. And that is it. We are right at our closing time. Thank you, colleagues, for joining us tonight.
Thank you, everyone, for coming.
Really outside your plate.
Thank you.
Thank you so much.
Thank you.
Outstanding.